Hey there, happy Monday. I'm Dr. Shiroko Sokitch, owner of Heart to Heart Medical Center and the author of the book, Healing When It Seems Impossible, 7 Keys to Defy the Odds. Recently, I've been researching peptide therapy and learning a lot about that and wanting to help people understand what it is. It's an amazing tool, actually, and there's been a lot of press, of course, about certain kinds of peptides like the GLP-1. I'm sure you've heard about Ozempic and Mounjaro, and a lot of people are taking those things these days in order to help them with weight loss and appetite control. And there's a lot of research showing that it may have other benefits. But I want to talk about peptides as a big picture thing, and that there are some peptides that are even more interesting than the GLP-1s. The ones that, so GLP-1s are the ones that are kind of related to helping manage blood sugar. So peptides, so first of all, I'm going to tell you what peptides are. Peptides are small chains of amino acids. Now, amino acids are the components that make up proteins, and proteins are usually huge molecules. They have, many amino acids linked together in order to form a protein molecule. A peptide molecule is a short chain of amino acids linked together to perform a specific function. Now, what's cool about peptides is that they are actually natural to our bodies, and most of them are something that that our bodies naturally produce when they need to perform a certain function. And some of them are really very interesting. So there are peptides that help the immune system. There are peptides that help regulate our energy levels. And there are peptides that help our digestion and help repair tissues. And they are all different kinds of peptides that can be used to help support us through various changes in our lives. Some of them have to be injected, so that, like, if you were going to use certain peptides, you would use a little syringe and inject them into your tissues. But others can be taken orally or used in different ways, and there's still a lot of research going on about how to take peptides and what they do. Right now, they are not approved as a treatment, so they're not a thing that you can do. Let's say, like, if I were to prescribe it, it would be an experimental treatment. So it's not something where I say, oh, this thing does this. It's this thing has been shown to make certain things happen for your body that might be helpful to certain conditions. And so, again, peptides are an experimental treatment modality. They are not considered a federally approved treatment modality where we can say this does that, although like Ozempic and Mounjaro and those medications are actually medications that are made from peptides. Insulin is also a peptide that was discovered long ago, and peptides have actually been around for a really long time. Like, insulin has been around for a long time. Ozempic and Mounjaro haven't been, obviously, but other GLP-1s have been around for a long time. There's one peptide that is actually made by your stomach, and it was discovered like in the 1970s actually maybe in the 1920s. It was discovered that it is a peptide that's produced by the stomach that helps repair tissue. And when you take it orally as a peptide, it has been shown to help support digestion. I've had patients who we have liposomal KPC or BPC 157, and some of my patients have taken that, and it improved heartburn immediately, and it helped. Some of them have been taking it for a little while, and it helps improve or it has been shown to help improve digestion. And there are other peptides that are also shown to have helped with many different conditions. I'm going to expand on this at another time, but I just wanted to start the conversation about taking peptides and how to use them, and that they might be of benefit for some conditions that people have struggled with for a very long time. So I'm looking forward to helping you support your bodies better. I hope you have a wonderful day, and I'll talk to you again soon. Thank you.